Looking down from here this morning, I must say to you all, you look so beautiful in your uniforms and colors. And the weather is God's stamp of approval for this day. It gives me pleasure to say welcome home to the families of health facilities throughout Fiji, here in Levuka. Distinguished guests, ladies and gentlemen of the health department, supporters and children, I would like to repeat what I said earlier. Welcome home, because this is where you all began. I'm honored to join you today to witness the World AIDS Day 2017. This year, the National World AIDS Day is hosted in the old capital of Fiji, Levuka, and the first ever national celebration for the Lomaviti subdivision. With the theme, Right to Health, I could not stress enough the importance of living this life free from sickness and disease, clearly defined by WHO and the UN Convention of Human Rights. We are all entitled to live a life that we enjoy individually in whatever communities we identify ourselves with. To chase our dreams, live a purposeful life, to be happy and meaningfully contribute to the Vanua, the church, and the country as a whole. Taking place on this first day each year, this is an important day to reflect on the worldwide campaign to unite in the fight against HIV, to show support for people living with HIV, and to remember those who have died from AIDS-related illness. The numbers kept increasing every year, and I'm sure along with the other NCDs-related illness, we are all given choices in life, and we have to live with its consequences. I'm rather concerned with our young people of Levuka, the future of Ovalau, looking at how active you are, and the trend we are going with communication made easy and network ability. With the youth population making up 65% of our population, and this same group making up a bulk of present future workforce, the socio and economic implication could be serious. The youthful population and the young adults are considered to be the most at the risk crowd. This year's Right to Health theme provides everyone with the right to realize the highest possible standard of health without discrimination or stigma. The Sustainable Development Goals, reinforced by human rights, provide a structure of leverage opportunity between the rights of health and other rights, including the rights to education, equality, non-discrimination, access to justice, privacy, and food. We stand with church and the government to ensure that we provide the best nurturing environment, the best supportive mechanism, and sound parenting platform for our children and the youths to be informed and access help of the highest quality living, no one behind. I wish you all the best of today, with an open heart and mind to learn as much as you could. With these few words, I here declare the World AIDS Day 2017 officially open.
I must sincerely thank the Rokotuinaceva and Levuka for allowing us to come and make a little bit of noise in the old capital. Today, we commemorate World AIDS Day. We stand in support and solidarity with more than 70 million people who have become infected with HIV. And remember the more than 40 million people who have died from AIDS-related illnesses since the first cases were reported in the late 1970s, and for Fiji in the late 1980s. World AIDS Day, since its inception in 1988, was the first ever global health day to be celebrated, and it continues to take place on December the 1st every year. The red ribbon is a global symbol for solidarity with people who live with HIV, their families, and their loved ones. It's also an opportune time for us to unite in the fight against HIV. And today, I am so grateful that I can see the support from all over the divisions who have made it safely across the seas to Levuka to mark this very important day. Allow me, the honorable guest, to share a few thoughts and efforts by the Ministry of Health and Medical Services. Fiji is considered a low prevalence country. Estimated number of people living with HIV in Fiji is less than 1,000. Cumulative number of people diagnosed with HIV since 1988 is also less than 1,000, with adult prevalence rate of 0.5% per 1,000 population. Ladies and gentlemen, today we're marking the 19th year of our fight against HIV since our first diagnosis in 1988. The number of new cases of HIV has slowly increased over the years, owing to increased awareness for testing, increased opportunity for screening through our antenatal clinics and during festivals and events, etc., and the availability of testing at divisional hospitals and some the delegated subdivisional hospitals. Over the last 5 years, there has been a slightly higher infection rates in females compared to males. This could be due to HIV testing being made available at all antenatal clinics across the country. Therefore, the pickup rate is higher compared to males. And a point to note, Fijians have a higher annual incidence of HIV. Annual incidence, colleagues, is the new cases of HIV every year, and subsequently a higher prevalence compared to Fijians of Indian descent and other races. As of today, more than 300 adults and children are on antiretroviral treatment all over Fiji, being followed up specifically at hub centers and the 3 divisional hospitals in Suva, Lambasa, and Lautoka. Please also allow me to share some of the activities and responses that has been provided by the Ministry of Health to date. Even though the challenges have been huge, our responses have also been strong and resilient. The provision of services to HIV comes at a cost. For the cost of equipment, supplies, medical treatment, etc. However, the Ministry of Health engages extensively with partners for technical advice and financial support like WHO, UNAIDS, UNFPA, UNICEF, and other donor agencies so that services can be provided free of charge to all of our families and the people of Fiji. In terms of problems and the way progress and the way forward, we also have a strategic plan that has charted the way for us from 2016 to 2020, clearly outlining what we are going to do in terms of providing the services for HIV in the country. We also are happy to say that the antiretroviral treatment, even though comes at a cost, is available free of charge to those who require it. So today I'm extremely grateful that we are gathered here in Levuka. We are excited, we have crossed the seas, and we are here to mark the day. It's a very auspicious occasion, and we hope that we all celebrate together and also progress our health in terms of our right and our health. So I sincerely thank everyone for your combined efforts thus far, and I must remind us all not to be complacent. I encourage us to continue the fight in preventing the spread of HIV, make provisions for those who need assistance, and at the same time allow everyone in Fiji to enjoy life to the fullest, including their sexual health. Remember, your health is your right. Claim yours today. Thank you very much.
Gentlemen, Nisam Bulavinaka. Nadango Christopher Lutukibuya, kaungon ni tobutoto may lau, kaubakatiko isuva. I was the first gay man in Fiji to come out publicly as a HIV positive, and I believe the virus was passed on to me by my male heterosexual partner, who was also married to another woman at the time. HIV meant extreme illness and death. The unknown was terrifying. Now, thanks to medication, the research, I live a very healthy life and happy. I learned that I was HIV positive when I was 25 years old, and I have been living with HIV for 5 years and going on to 6 now, and currently working as a program intern coordinating HIV and mental health program for Rainbow Pride Foundation, and also a student at the University of the South Pacific. I am also a member of the Fiji network of people living with HIV. Each day I took to build my resilience, especially because of the stigma associated with my HIV status. I want people to know that successfully taking modern HIV treatment means that I am undetectable, meaning I cannot transmit the virus to anyone else. It means I can protect everyone 100% just by taking my pills. It means a normal sex life, work life, family life, a happy life, and a long life. It also supposed to mean a fearless love, connection, and inclusion with everyone all at the same time. Sadly, this is not the case yet in Fiji, as there is still a lot of stigma associated with HIV due to the ignorance, lack of understanding, intolerance, and many other factors which often lead to the discrimination and exclusions of people living and affected by HIV. The theme this year, World AIDS Day, the theme of this year's World AIDS Day is Right to Health, with the campaign message, My Health, My Right. The universal and inalienable right to health provides everyone with a right to realize the highest attainable standard of health without discrimination or stigma. Only by placing human rights at the center of all our health service can we ensure that healthcare is accessible, acceptable, available, and a good quality for everyone, leaving no one behind. HIV-related stigma is the main reason Fiji will not reach the fast-track 1990 ambitious treatment target to help end the AIDS epidemic. The targets are, by 2020, 90% of people living with HIV will know their status. By 2020, 90% of people with diagnosed HIV infection will receive sustained antiretroviral therapy. By 2020, 90% of all people receiving antiretroviral therapy will have viral suppression. The recent study on people living with HIV in Fiji Stigma Index shows that stigma and discrimination manifests itself in many ways. Discrimination and other human rights violations may occur in healthcare settings, barring people from accessing health or enjoying quality health care. Some people living with HIV and other key affected population are shunned by their family, peers, and the wider community, while others face poor treatment in education and work setting. Erosions of their rights and physical and psychological damage. These all limit access to HIV testing, treatment, and other HIV services. UNAIDS and the World Health Organization cites a fear of stigma and discrimination as the main reason why people are reluctant to get tested, disclose their HIV status, and take antiretroviral drugs. If government, development partners, donors, civil societies, communities, and all stakeholders do not prioritize their resources in tackling the root cause of stigma and ensure services are inclusive and accessible, Fiji will never achieve the 1990 targets, nor achieve the 3-0 goals by 2030. 0 new infections, 0 new discriminations, and 0 AIDS-related deaths. The use of specific programs that emphasize the rights of people living with HIV is a well-documented way of eradicating stigma, as well as being made aware of their rights. People living with HIV can be empowered in order to take actions if these rights are violated. Ultimately, adopting a human right approach to HIV and AIDS is the public interest. Stigma block access to HIV testing and treatment, HIV making onwards transmission more likely. The removal of these barriers, services, is key to ending global HIV epidemic. Together, we can break down the stigma in our community. Let's end the stigma so people like me can live without fear of discrimination. HIV does not rule my wonderful life. I choose to use my diagnosis to make a wonderful life for other HIV people. Thank you.